payments and fee schedule. So yes, today we're going to focus on Medicaid payments and fee schedule overview for the currently live climate and outreach and engagement activities. As last time, today also we are going to seek some feedback about these payment schedules that we are going to discuss later in our slides. Your feedbacks would be very helpful for us to decide what looks good for our community and what might work or not work, and find further process to sort that out. So thanks again. Next slide, please, Trevor. Next. A little bit of Zoom meeting tips. So as always, please use the chat function to ask your questions. And then we'll be saving this chat for our, again, to check the feedbacks that we have not probably responded to and would be helpful for our future policy making, as well as our own planning for these sessions. And we'll also have some time after the end of the session to just ask any of the comments, or if you share any comments, or if you have any questions. So please feel free to raise your hand on the icon on Zoom meeting, and then we'll request you to share your feedback. As always, this webinar is being recorded, and we will be sharing these recorded versions with you, all of you who are present today. For live captioning, please click the CC button at the top of your screen, at the bottom of your screen, or click the link provided for Spanish captioning for those who want to listen to this webinar on Spanish, or read the captioning. For live interpretation help, please click on the interpretation button and choose either you want to hear it in English or Spanish. Thank you so much. For the next slide, please, Trevor. And now let's do a little bit of group polls, so we know which, first we want to know which counties you are coming from. This will help us to know if we are missing out any particular counties, and again, plan to reach these counties more. So please attend to these polls. Am I audible? Yes. Oh, there is a poll on Jesse Powell. There is a poll right now on your screen. Are you able to access it?
No.
Okay. Yeah, that is why no one is answering. Sorry, Jesse.
Okay, no worries.
Okay, some people are able to do it now. Hi, Laura. Are you able to answer the poll? No. Oh, okay. Nice. I see. It's this Zoom app. Thanks, Peter. Thank you so much, Bethany. I cannot see how many people have already answered the poll. Can you please check, Trevor, and see if we need to stop and go to the next question?
We're right at 79%. Oh, sorry.
Oh, that's nice.
I inserted myself in. My apologies. Here to help.
We have about 80%. So what I'll do next is I'll share the results so you all can see sort of where various partners are coming from, and then we can move on to the sector.
That's lovely. Now I think you guys can see the polls. I'm so glad Clackamas and Benton County have higher representation today. We really hope we'll try to see what is happening with the rest of the counties, and if we can help more people attend it. Can we go to the next one, please? Thank you, Trevor. Now it's which sector you're representing. The way it will help us is we'll know how many more people perhaps have any interest with the climate related activities. We also and then how many other representation is there for our housing as well as our nutrition related activities. And then I also, this will help us sort those representation. And maybe seek you out when we need more help in these policymaking benches. In the meanwhile, Trevor, can you go to the next slide, please? While we attend to these polls, this is one of the requests that our colleagues wanted us to share with you. For those who want to apply or are applying for HRS to be HRSN providers, please email our provider enrollment in this email ID. Please note it down if you would like to. We are going to share these slides, but for now, if you are in the process, this would be super helpful. So once you email us in this ID, then this will alert the team and they'll move your application up in the queue and expedite the processing, because we get a lot of other emails too. And we don't want this to be, your application to be delayed because it got somewhere in the queue. So please email us on this and it will really help us approve or get the process faster. Thank you. Now this is the poll for our sectors. Thank you so much. We have high representation of our CBOs. We love it. That's great. We have climate services and support 15% and cultural specific organization. I love seeing this. And behavioral health services and healthcare workers too. Thanks so much. Now we'll go to the next slide. This is the agenda for today. So first we'll speak a little bit about an intro, which will also include Medicaid overview and fee schedule. And then we'll go to Medicaid overview and fee schedule. Then we'll talk about HRSN climate services, which are again currently live. Within the climate services, we are going to talk first about the service definitions, because that will help us understand the fee schedules that we are going to propose much better than having to recall what these service definitions are. Similarly, we are also going to discuss about HRSN outreach and engagement activities. And again, these will be the same way. First, we'll be sharing the service definitions and then the fee schedules. And then we can, at the end of our presentation, we can go for comments and questions. But in the meanwhile, you are very welcome to share your feedback in the chat function. And our SMEs who are available here will try to answer those in the chat itself. I do have one request when it comes to the chat function. Suppose you're asking about outreach and engagement of climate services, do write that somewhere at least in the beginning or somewhere there, so that we don't get it confused with outreach and engagement in general or about nutrition and housing, and it'll just make answering your questions faster. So thanks a lot. And let's go to the next one, Trevor. Next. First, a little bit on what is Oregon Health Plan. I am sure all of you know now, but just for overall review, Medicaid is nation's medical assistance program for families that is individuals actually. In Oregon, we call it the Oregon Health Plan. Like every state gets to name their Medicaid program, and we call it Oregon Health Plan. In Oregon Health Plan is a free health coverage for children, teens, and adults. who live in Oregon and also meet income and other criteria. People can apply for OHP, which is Oregon Health Plan, at any time during the year. And next one, please. Yes. So the way we actually provide these services are through, that is the services for Oregon Health Plan, is through coordinated care organization or through open card. Now, those a coordinated care organization is a local organization. So there are multiple coordinated care organizations, but even these organization is a local organization that helps some Oregon Health Plan members use their benefits. And please note, I said some Oregon Health Plan members use their benefits. CCOs are made up of all type of healthcare providers in a community. They work together to care for OHP members in an area or a region of the state that they provide services in. So now, as I said, please note some Oregon Health members are helped through a coordinated care organization. Those who are not supported through CCOs or coordinated care organization are supported through our open card system, which is also called fee for service or FFS. Now, this is covered by Oregon Health Authority, the OHA, directly, and OHA pays for their care directly. Thank you. Next one, please, Trevor. This is getting more into the topic of conversation today. So today we are here to discuss more about 1115 Medicaid waiver HRSN services, that is health related social needs services. So a little bit overall idea about what is 1115 Medicaid waiver. So the federal government has a standard set of rules that each state must follow to get funds for Medicaid. And then sometimes when states have needs that may not be as or might be different, or states have more ideas to how to fine tune their programs, then they can also ask for federal government for permission to change their Medicaid rules for some of these programs. And this is called the Medicaid waiver. And so this is one of the waivers we are working on right now, which is health related social needs waiver. In the past, there have been other waivers too. And this, so Oregon's new 1115 Medicaid waiver, which is health related social needs waiver, services, is an OHP covered benefit. And it was, is first in the country. So along with you guys, we are also learning. That is the main request when we seek feedback from you. And it started in October 2022 and will continue till 2027. As you are aware, the first one within these services, the first that went alive was in March 1st, the climate services. And today we are very excited to hear more about how your experiences are going with that. And then further down the line, we will be launching nutrition, housing and nutrition. Next slide, please. This is for Chelsea. I will invite Chelsea Guest now for this slide.
Hi, everyone. Thanks for joining us again this week. My name is Chelsea Guest. I work at the Oregon Health Authority. My pronouns are she, her, and I am the CCO Finance Director. I lead the work on pricing for the HRSN services in the waiver. As just recently discussed, thank you so much for that introduction on the work that we do. And then I also work with the CCOs directly on some of their more broad capitation rates. One of the things that is required of our waiver is to create a fee schedule for health-related social needs and distribute that and kind of facilitate the payments related to these new services that are coming online at different times. As you all know, climate has gone live. Some of the outreach and engagement services have gone live, and that's what we're here to talk to you about today. Part of the fee schedule that's built is it's focused on a maximum rate in most cases. Some are straight fee schedules, and we'll talk through that a little bit. But we want to hear how that's working on the ground related to climate and outreach and engagement today, and hopefully get some feedback on any areas of improvement. Fee schedules can be changed, but they need to be kind of reviewed regularly as well. So we're excited to get your feedback. There are two ways this fee schedule kind of reaches the program. One is through CCOs. So our coordinated care organizations can have enrollment, and they are also held to this fee schedule and how they reimburse their providers directly for services for their enrolled population. The fee schedule also manages how the open card or fee for service members receive this service as well. So it does cut between both of our populations, no matter their enrollment. And it's very broad in terms of how that works. No matter how much this is paid, this is very, it does depend on the service and the cost. We want to make sure we're paying for the cost of the service, even if there is a maximum that is higher. Next slide. Oh, sorry, one of them got dropped. I was expecting another one, but just real quickly, one of the considerations is making sure that it's appropriate to the staffing and the services that are provided. Sorry, I'm looking at an old slide deck. My apologies. And making sure we understand some of the costs on the ground and the geographic factors that impact these fees. So you can go to the next slide, and I'm going to pass it to, I believe, Amelia.
Awesome. Thank you, Chelsea. Good afternoon, everyone. I'm Amelia Reynolds. I use she, her pronouns. I am the lead policy analyst on these climate-related supports. So kind of the plan for this next section here, as Satya mentioned in the beginning, is that I'm going to walk through what is included in this benefit so we can kind of frame and understand here are the devices that folks are eligible to receive, and then some of the additional supports that are provided. And then we'll look at the fee schedule, the rates that are set up for those devices and for that service, and open it up for feedback to say, like, do these make sense? Is this an appropriate rate for what we are proposing that folks will be doing, or the devices that they'll be receiving? That's kind of an intro of where we'll go. And so to get us started, I will say next slide and talk about what is included in climate-related supports. So we've done some previous presentations on this benefit. You can find lots of information on our website. There are recordings of what all is included in this. So for today, I'll keep it high level and say that for the most part, climate-related supports are really covering under the waiver under folks' healthcare plan, covering 5 device types. The first one being air conditioners, portable air conditioners, so those ones that sit on the ground and vent out the window. For portable heaters, these are like space heaters. Again, portable is a key factor here. Air filtration devices, again, standalone, smaller units that just plug into the wall and help clean things like wildfire smoke out of the air. The fourth category is portable power supplies. This is a broader category, but it really includes those larger battery backup systems that could run medical devices for at least like 24 hours. So the bigger batteries. It may also include gas-powered or propane-powered generators for those who do have a safe space to use it, and that's a better fit for them. And then the last piece is mini refrigeration units for medication storage. So again, that's the 5 devices that are covered under this. And I'll walk through kind of the specifications now that we have assigned to each one that kind of provide these guardrails or the range for the types of devices that we're thinking of. So we can go next slide. Perfect. So as I mentioned, the first 2 devices here are going to be these portable air conditioners and then air filtration devices. So for the air conditioners, these are standalone portable units. On the slide, we do have a visual image of what these units typically look like. And these are just examples. So there are many that will fall into this range, but we've just provided some examples. As far as kind of how much, like which device we choose, we're saying that it should cool around 400 square feet. So that would be a larger bedroom or living room size. If you're looking at these types of units, they are rated by BTUs. British thermal units, a fun acronym I learned. And then we're hoping that these are Energy Star rated, meaning energy efficient, knowing that they do use power. So we'd like them to be as energy efficient as possible to reduce the burden on electricity and utility bills. That's the first device. Second device are these air filtration units. One key factor here is that it must not create ozone. Ozone can have negative health effects, and not many have them, but we do have to call that out. And then rated for PM 2.5, that's a technical term. Don't worry about it too much, but that really just means wildfire smoke. That's what's in wildfire smoke. There's some organizations that rate these devices, and they rate the speed at which they clean rooms. We've included some guidance there. The good news is that in most cases, our open card provider or our coordinated care provider are going to be interpreting these and selecting devices. So we don't need to get too caught up on the specifications here. HEPA filtration, that's a key standard. That really just means the standard at which it's cleaning the air is going to be much higher. So it will work on things like wildfire smoke. And then we've tried to keep these a little bit on the lighter side, so they're portable. And then again, energy efficiency. Not clearly listed here, but I do want to mention it since I see a comment in the chat about the filters is yes, they will be sent with an extra replacement filter. And if a member is still eligible for this benefit, replacement filters are also included. So we've already had a couple examples where folks have only received a replacement filter for their device because they already have a working device. They just need help replacing the filter. So you'll see that on the fee schedule as well. All right, we can go next slide. All right, I think these next two ones are a little bit more kind of straightforward. Our mini refrigeration units for medication storage. Basic fridge functionality, cools down to 36 degrees. We don't want a freezer compartment. We don't want anything to accidentally freeze for these medications. Energy efficiency. That one's pretty straightforward. Portable power supplies here. The preference is for emission free. That really means battery powered, not gas powered. We will have an exception process for gas generators for folks who that's just the best fit for them. So I called that out before, but I will mention it again. So for these larger batteries, we do want, if they're fully charged, them to be able to just sit for 3 months fully charged so that people don't have to worry about constantly recharging them. And then the 1500 watts, that basically equates to what I was mentioning of that they will work for at least 1 or 2 days to keep these medical devices running to hopefully kind of bridge that window if there's extended power outages. So it's kind of the ratings there. Then we'll move to the last device here on the next slide. Space heaters. I think these are probably a device that folks are super familiar with. And we really focused on the safety features of these space heaters because it does have these heating elements, but the safety shut off. So if they get knocked over, they automatically turn off. Low and high settings, they don't always need to be on high. We did max surface temperature so that if somebody were to touch it, it wouldn't be harmful. Again, a safety feature. And then looking to heat about 200 square feet. And then again, portable being the key factor for all of these devices. These aren't systems that need to be installed directly in the home like these bigger units. These really are a small device that somebody could take to different living situations or move around their home either between rooms or something like that. So that is the overview of the 5 devices. I know it's a lot of information, but I think it just kind of helps frame the type and style and like quality of device that we're looking for. So we go next slide and we'll take a look at the initial fee schedule. So we'll ask that folks can put feedback in the chat. It can also be emailed. I think somebody checked me on this, requesting for feedback by the 23rd. But you can verbalize it, you can put it in chat, you can have it emailed to us later. But wanting to kind of review kind of what have we expected the rates for these to be, and then kind of check our understanding of, did we get it right? This is a new program, so we can't change it all the time, but we can ask and get feedback on where we landed. and make some adjustments as necessary. So the very first one, this air conditioner, this is where we've done the expected cost at $660. And the way that this will be reimbursed is at actual cost. So if the invoice says that a unit was $550, that's what it's going to be reimbursed at, because it's the actual cost. I will note this thing at the bottom of the screen that we're allowing for the 150% factor, which means that we can pay up to 150% of that expected cost on the screen. So a unit that was $750 would still be within the $660. All right, the next one that we have is the air filtration device. That one is set at $500. And same thing, these all have the up to 150%, but will be reimbursed at actual cost. Just calling out the replacement filter question, $70, again, 150%, so it can go up above that. That's where we've seen most of the filters around for the state program, like the previous devices that we've sent out with Senate bill funding. So that's for the replacement filters. Again, those are included. And then the portable power supplies, or we call it battery generator, or again, the exception for the gas power generators, that's right around $1,590 as the expected cost. Again, can go up to $150,000. So realize that's 3 devices at once, but I will pause there and get if there's any feedback that folks want to say out loud or put in the chat, I can verbalize it if we put it in chat too. Great question in the chat of how do these fees cover staff time? If I pay $500 for an AC unit and get reimbursed $500, what about the time it took for my staff to connect the individual in person, discuss options, time to order, time to set up delivery, time to follow up? So for these climate devices specifically, it's just for the device. On the next page, we'll cover installation and we'll want to get feedback on that. But it sounds like what you're describing might actually fall into the outreach and engagement portion of the process, which Teresa is going to cover next. So I think a good chunk of those pieces of like outreach to the member, if they are likely eligible with these benefits, what does the process look like to have a conversation with them, to get their information, to send that on to a coordinated care organization or the open card provider? That will likely fall under outreach and engagement. So it's a great question. And then I'll see if Teresa can add information when we get to that section. But yeah, so I think the simple answer is it'll likely be covered under outreach and engagement. All right, I think I can move us to the next slide. I can always jump back for questions, and I'll hit the next couple of devices. So portable heaters here is at $290. Those simple mini refrigerators, about $170. And then I think the critical one, because this is more of a service than the actual item itself, so we're looking for a little bit of feedback here, is climate device installation, which is currently listed as per service at $28. So the 150% factor would put that at $42 at the maximum allowable. So if there's any feedback on heaters, mini refrigerators, or the actual service of installation, we'd love to hear what that might be if you've got any. While folks are maybe thinking on that or typing up responses, I will say out loud, the deadline for emailed feedback from last week's presentation, which did have housing and nutrition, is the same date of the April 23rd. So feedback on both of these, all 3, 4, the collective fee schedules is April 23rd.
Acacia has in the chat another follow-up, Amelia. So I wondered if we wanted to try to quickly address that. And Acacia, I apologize if I'm pronouncing your name wrong. We will get into that a little bit, but I wanted to have a little bit more understanding. So outreach and engagement, as long as an HRSN service provider is billing for an Oregon Health Plan member, and I'll get into the details in a minute, you can bill for the first connection to the member before you know they're authorized for services. So you wouldn't be able to bill for the climate device, but you could have billed for a little bit of your staff time there. So I would just wanted to call that out. And then outreach and engagement can be used after the authorization is complete as well, as long as that person is eligible for HRSN services. Does that help a little bit? And did you want to provide any clarifying information there? Okay, great. Thank you. I just didn't want to leave that one alone, Amelia. I think you have more questions specific to climate.
You're good. Thank you, Teresa, for jumping in. It's the joy of having colleagues that that know better answers when we start to get out of each other's lanes. So thanks for jumping in. I do appreciate it. Okay, so looking at some of the feedback, and thank you all for putting this in the chat. We do appreciate it. Apologies while I scroll a little bit. So in rural areas, there might be quite a bit of mileage to get out to the installation. Is there any reimbursement for mileage? No. Currently, this is set up as a per service fee. So this is exactly the feedback we're looking for. If this is not conducive to how you'll have to operate to be able to do this, we need to know about it. So I think by asking that question, it might include extra time and mileage that maybe wouldn't be captured by the $28 to $42. Anticipated labor to install the AC. There's a little bit of a range from what we've heard in programs that have existed prior to this being a benefit. One of those is mileage and drive time. When you get to the individual's home, there might be some small moving of items to clear the space underneath the window. In a straightforward, easy installation for that AC unit, there is kind of unwrapping it, setting up the drain hose, and then the vent gets installed in the window. It gets sent with a simple piece that can go in the window. Full acknowledgement that that installation piece does not work for everyone's window type. So in rare occasions, folks have had to get a different kind of window kit to be installed with the AC unit. That might be part of an earlier conversation, but that might be included. Again, they should be, it's a relatively straightforward install. You know, there's always exceptions. You might walk in and find some other stuff.
How to apply, what the funding limits are, and some important.
Oh, Teresa, I think you might be off mute.
Sorry.
You're good. I don't know if it was you, but I blamed it on you.
It was me. I don't know how that happened, but it totally was.
You're good. Sorry, folks. Okay, so Greg, thank you for that. For most cases, the actual cost will be more in the neighborhood of $50 per hour. Okay, so there's some feedback on maybe shifting to a per hour process or rate type, excuse me. It's a good question about, I'm assuming clients may need education after installation on use and upkeep. Would this be paid for as part of installation or as outreach? I don't think this is something that is explicitly covered as part of either one. I don't know, Teresa, do you have any input on whether that might be a good question that we take back and kind of discuss internally then?
Yep. Off the top of my head, I don't know if that would be covered under outreach and engagement. So we'll think about it.
I'm saying, do we need to use a licensed contractor to do installation? This isn't really falls within any specific license. There shouldn't be any like construction or electrical work or anything that requires licensure. I would say that one of the ways that I would frame a response to this is it's not in our provider qualifications to be an HRSN service provider who would do installation. There's no requirement for specific licensure or contracting. I think coordinated care organizations or our open card provider, when you enroll as a provider, have those like, oh, we're installing on behalf of this coordinated care organization who sent the device. They might have some requirements, but it doesn't fall within like something that a contractor would need to do. No. Per hour would better allow for accurate reimbursement of time. Thank you for that feedback. Here. Thanks again, folks, for just bearing with me as I read read the comments and make sure we get answers and document the feedback. Our community health workers have experienced challenges with navigating CCO processes related to requesting climate devices. There's a great deal of confusion on if they should assist members with submitting an HRSN application, a flex fund application, or both. Or they're hoping there is no wrong door and that a request. I scrolled on myself. This was my fault. While they're hoping there is no wrong door, that a request through either of the processes would be appropriately routed internally by the CCO. There's not been clear guidance on if or how climate device requests are being triaged. In most cases, community health workers won't know the client will be determined eligible under HRSN or will be best suited for flex funding. Can you provide any insight on what the direction to CCOs on this has been? Yes, so I can talk a little bit about what we've heard that the process has looked like. I will say that for many CCOs, their process internally might look different from another CCO. So this might not be the same for every CCO, so I don't want it to be applied to every single one. But the idea is that we could start with HRSN. So if somebody is a member of one of the transition populations that makes them likely eligible, the clinical risk and social risk that comes next. So do they have a health condition that would be made better by one of these devices? And then do they not already have a device and have a safe space to use it? Those are a lot easier. So if somebody is in a transition population, should start with submitting via HRSN. If a CCO then gathers more information and says, actually, no, this member is not eligible under HRSN, some CCOs are automatically looking at this same request under flex funds or health-related services or flexible spending. It's the same thing, just we call it 3 different things and people use different phrases. So I just want to call it by all 3 so that folks know what we're talking about. While HRSN is a benefit, HRS may. So it's not guaranteed that it's available by every CCO, but many CCOs are saying, okay, if somebody, made it through for HRSN, they thought they might be eligible and they get denied, they will look to HRS or flex funds next. In some situations, maybe you all or a member might not know immediately what the outcome was, but they'll still get a device. So they're trying to make it a little bit kind of seamless where the details get worked out by the CCO or on their end. And some might have to submit another request after the HRSN is denied for a device under the flexible services. So just a full range there, but in many cases, it will be more of a behind the scenes process from the CCOs. And at this time, the additional plexiglass insert is not covered by, unless it was within that $28 to $42. All right, I think I have to stop there to make sure that Teresa gets some time, but thank you for the feedback and questions that we've received so far. I might not get to them in chat directly. And window AC units, just the plexiglass, like, yes, it could be covered. We can allow for the in-window units if that's the only thing that will work for somebody, so there's flexibility there. And yeah, there might be a situation where plexiglass is needed based on the window type that an individual has. Yeah, thank you. Keep throwing questions and things and feedback in the chat. I might not be able to get to them verbally, but I can try and respond via chat or just take them back as feedback. Any information you can provide around what might be needed or helpful for the installation fee or otherwise is really helpful. So thank you all for the time and the feedback.
Thank you, guys. And if we have time later, after Teresa finishes her presentation, we can come revisit these questions too, if they're unresponded yet. Teresa, now you. Thank you.
We probably won't have time. I like to talk.
Yes, we'll try.
Hi, everyone. I'm Teresa Young-White, she, her, hers. I work with the Oregon Health Authority, and I work on the outreach and engagement benefit that we're going to talk about today. Let's see. Let's go to the first outreach and engagement slide, please. So we're just going to go over quickly the overview and then get to the fee schedule and some other questions that we have for you today. So outreach and engagement is intended to identify OHP members. They do have to be an Oregon Health Plan member who might be eligible for HRSN services. It is intended to connect them to those services to see what additional services under health-related social needs they might need. And then it's also intended to connect them to other resources as possible, as needed. So right now under climate, we just have a few activities that we have covered, but it will expand quite a bit when we get into November and January for climate, housing, and nutrition, all of those activities. But we started out with a small subset of activities to discuss here today. You can go to the next slide, please. But I just want to be clear that we have more activities coming, and that'll be, we'll be getting your feedback on those as well. And those will be things like connecting to other non-medical resources, potentially connecting to the medical system more, and other things as well. So today we have 4 activities that are covered, and that's engaging with members who may be eligible for HRSN services. It's also verifying their enrollment. Are they in a coordinated care organization or with the open card or fee for service, as it's often known? And which CCO, if they are in a CCO as well. And so those 2 things are required to bill for outreach and engagement services. And I should clarify, excuse me, that you do need to be an enrolled Medicaid provider with OHA and an HRSN service provider to bill for these services as well. And like we talked about a little bit, the CCOs have different processes for those, but you can also enroll with open card and go through that process. And then you could go through one or multiple CCOs to enroll. You also, one of the biggest questions we get is, can you be just an outreach and engagement service provider? Let's say you don't provide climate, housing, or nutrition. Currently, climate is the only one live, of course. You can be a outreach and engagement HRSN service provider. A couple other things that are currently optional would be helping the member with the request form or that information that it contains and getting it to their health plan, so the CCO or open card. And then this is a big part of the intention, providing members with information and connecting them to other legal, social, or medical services there. And like I said, this is going to open up quite a bit in November. Okay, next slide, please. I think we might have went backwards. Okay, maybe not. Maybe I just had another one there. So what we really want to get feedback from you on is this, and then one more question here. But what we have here is $20 per 15 minutes. So if you engaged with a member, you helped them submit an HRSN request form after verifying they were in CCOZ, let's say, and you spent 10 minutes with the 15 minutes with the member, you could bill to that CCO as an HRSN service provider. If you spent a half an hour, you would bill for 2 of these units. So it's $20 per 15 minutes. And that is tied to one date of service. So you would need to have spent that time on the phone or with the member in person that day, that 15 minutes. This is, yes, Jane, we will absolutely, oh, and hi, Jane, we will absolutely share this. I just saw in the chat. So currently we have 5 hours per member per 36 months for the climate benefit. So if you are an HRSN service provider and you spend an hour with a member, then you have 4 hours left to spend with them and help connect them to the climate devices as well. So I think we want to stop here and ask you if $20 per 15 minutes, how does this feel to you? And is this something that works? I think the questions are on the next slide, please. Is this something that you feel that would be give you the ability to provide these outreach and engagement services? Can you go to the next slide, please? Okay, there we go. Yeah, I wanted to get there. Yeah, so what I said, does the rate make sense? Would it work for your organization if you were providing outreach and engagement services? The 5-hour time limit right now is 36 months. So 3 years, Howard, I see your chat, but that's going to change really soon. So in the November live, we don't have the exact amount yet, but it is going to change, and that it will increase, and it will be, sorry, so my allergies are kind of getting at me, and it will be for all of the benefits, and you will have more hours under all 3 of the benefits. Okay, can you go to the next slide for me really quick? I'm going to get to the questions in the chat. Yeah, let's skip ahead really quick because I've seen a lot here, and so let's just move. We're going to run out of time too, so let's get to what people are talking about in the chat. So one more. Okay, actually go back for 1 second, sorry, to the activities. So this is going to be the breadth of activities that will be eligible under outreach and engagement here. So it will be things like helping the member to maintain their enrollment in Medicaid. So helping them with that paperwork if they're an OHP member and need support there. Connecting folks to other social needs settings like showers, laundry, food, helping them with getting their birth certificate, etc. So I wanted to talk about that, but I'm looking at the questions, and so I want to move on to this last slide here. I think we probably needed more time to talk about this, but I figured that. Okay, so this is what's really important, because the 5 hours seems pretty small right now when we're talking about this. And so what we're looking at, the proposal on the table, is moving to 20 hours per year for climate, housing, and nutrition. So that would start on November 1st. Well, that would start on January 1st, but we would add hours in 2024 to account for the housing benefit going live as well. So I'd like to talk a little bit more about, looking at the questions in the chat, that benefit cap is actually going to increase quite a bit. So we don't need to address the 5 hours for climate. So that would be, yeah. So Peter and Howard, just looking at your questions there. It's for all of the services under health-related social needs, but it's 20 hours on an annual time frame and not a 36-month time frame. The time spent working on forms and engaging with the members, documenting the outreach that you've done, documenting the outcome of the outreach and how you connected with the person, Misha, those are absolutely reimbursable in these activities lists for the future as well. Currently, you would need to bill for engaging with the member, verifying. So in the background, you could be verifying their enrollment in the background. That might not be time spent with member. It might be looking up to see which CCO they have and connecting them to their CCO. Some of that absolutely can be staff time and background work there, as long as you're connecting them to the HRSN services. I see some other notes that the rate should work as long as the admin time for billing is relatively simple. The invoicing is probably, I would hope it's not too complex, but for a lot of community-based organizations newly becoming HRSN service providers, that can be difficult at the beginning to get those set up. We really encourage folks to talk to the regional CCOs about the community capacity building funds, and I'll share a link in the chat to help with that first startup, that technology or workforce development infrastructure to get, so you can be able to build, learn how to build, get the technology set up from the start, and then hopefully it becomes easier over time, of course. Okay, still looking at some questions. So $80 an hour seems reasonable. Some folks, depends on how much documentation is going to be required. Absolutely understand that. Those 20 hours would only be outreach and engagement, not the tenancy, pre-tenancy housing services. Absolutely. Outreach and engagement, this service is, it's not separate from other HRSN services, but that benefit cap is. That's 20 hours for HRSN outreach and engagement. And thank you for some folks. Kathy, I see your note about spending 20 hours on just housing, and I want to be, I'm appreciative of that. Excuse me, there is some hope that the CCO support with their care coordination team would help fill in some gaps, but there is also going to be a clause that there's exceptions can be made on a case-by-case scenario by the CCOs if they really feel that this member needs more targeted and focused and direct outreach and engagement services. But generally the 20 hours over a year will be the benefit cap as of now, but it's good to hear that you believe that housing could take a lot. We tried to take that into account because housing is very complex at times, 100%.
There's another question, Teresa, that if a member is accessing multiple HRSN services over time from multiple organizations in a single year, how do we keep track?
It's a very good question. So the coordinated care organizations will be keeping track of those 20 hours. The hope is that a patient-centered care plan will also be supporting the member. So the CCO will have this care plan that is there to support the member, and the care coordinators will be working really closely with the HRSN service providers as well as the member. This isn't a requirement, so we're still thinking about and looking at tracking those benefit hours and how we can support the HRSN service provider and ensuring that they don't go over that cap. Absolutely. The CCOs will be able to capture that by member, but how do we get that back to the HRSN service provider is a little bit of a question. Absolutely. So I hear you.
There's another question, if there is a limitation on who can do this outreach and engagement.
The limitation would just be becoming a Medicaid provider and an HRSN service provider. And then to become an HRSN service provider, there are certain qualifications. You do need to be a culturally responsive provider, have experience with outreach and engagement, serving Oregon Health Plan members, et cetera. And there's some other ones there. We do have a provider qualifications video posted online with a lot of that information, as well as some fact sheets that will be available as well for that.
The last question is, do these outreach engagement need to have any special licensing or certification for organization to qualify?
That would again be along the lines with those provider qualifications. You do have to have, but as far as what I think the goal of your question is, they don't need to be a special certification though. As far as, so sorry, I just have this tickle today. As far as needing to be, I don't know, a behavioral health specialist, just throwing out there, or a registered nurse or some sort of licensure like that. No, there is not a requirement for that, or even a certification as a traditional health worker or a community health worker type thing. There wouldn't be a requirement for that, no. And then I see another note, but then I know we need to close out that it's typical to use 20 hours in 10 weeks. So that's a really good to hear and good to get feedback on that. The other questions we will have to follow up, I think, at another time, but please do email us. And I think Satya will give you the
email IDs
about how to provide additional feedback.
Yes. Can we please move on to the next slide, please, Trevor? And the next one. So this is where you can provide us your feedback. So the first one, please provide us your feedback in this. And if you have specific feedback for payments and payment schedules, then please provide it to us by April 23rd, so that we can include them in our in the policies that we are designing at the moment. And thank you so much for joining us today. Thanks to all of our SMEs for being so gracious to be present here the whole time and trying to respond to all of the questions. Thanks again, and please meet us next time. Thank you. Bye-bye. Have a great day.